Hello everyone, welcome to my YouTube channel Name Info. First of all, subscribe my channel and hit the bell icon. Today we are going to talk about stroke. We will talk about different types of stroke and what are the arteries that supplies brain. What if that arteries are blocked? What are the body parts that are affected? And how to manage a stroke patient in emergency. Today we are going to talk about that. First of all, we will define stroke. Stroke is interruption or reduction of blood supply to area of brain that results in brain death. There are two types of stroke, ischemic stroke and hemorrhagic stroke. In ischemic stroke, the arteries that is supplying brain is blocked, which results in the death of the brain tissue. In case of hemorrhagic stroke, the arteries that supplies the brain is ruptured and the blood supply to the area ahead of that artery is blocked. Hemorrhagic stroke has various types. First, subarachnoid hemorrhage, when the bleed is around the brain. Second, intraparenchymal hemorrhage, when bleed is within the brain. Ischemic stroke can be of two types, either embolic or thrombotic. Embolic stroke are one in which clots from anywhere in the body gets stuck in the vessel that supplies the brain, resulting in blockage of blood supply to the tissue and brain death. Embolic can be due to atrial fibrillation or endocarditis. Both are the conditions in which clots are being formed in the heart and those clots block the arteries of the brain. Thrombotic stroke results from chronic atherosclerosis, that is deposition of fat within the vessel. The deposition of fat results in decrease the lumen size of vessel, resulting in decreased blood supply to the brain and stroke. Now we will talk about blood supply of brain. Blood supply of brain mainly consists of anterior circulation and posterior circulation. Anterior circulation arises from internal carotid artery and posterior circulation arises from vertebral arteries that arises from vertebrae. Anterior circulation include anterior cerebral arteries and middle cerebral arteries. Posterior circulation include the vertebral arteries, basilar arteries and posterior cerebral arteries. All of these arteries combine to form circle of Willis. Now we will discuss what if these different vessels are blocked and what are areas of body that are affected by blockage of these vessels. Remember, any stroke in the brain always affects the opposite side. If there is stroke in the left side of the brain, it affects the right side. If anterior cerebral artery is blocked, that results in stroke that affects leg and feet much more than the upper limb. If there is stroke in middle cerebral artery, it affects face, arm and speech of the patient. If there is stroke in posterior cerebral artery, it affects the vision, that is the eye of the patient. When paramedium artery is affected, it damages pons. Damage to the pons results in lock-in syndrome, that is, whole body is paralyzed except eye. Thanks for watching this video. The next part will be coming soon.